Hello, hello, good night, everyone. It's been an extremely long time. I think every time I jump on, I say that, and I think it's just a testament of how busy it is in the world in terms of just trying to work every day and go on with life. And when you have goals, like for me, my goal is to educate people. And sometimes it's very hard to stay focused on that goal when you have to work and do other things. So I'm not going to stay on that too long. I really wanted to jump on and talk to you guys about something that was near and dear to me, which is health maintenance as providers. So, last night, I had to diagnose 2 patients from the emergency room with metastatic cancer, and that's very hard to do as a provider from an emergency room setting, and admit a patient that's pretty much inconsolable, rightly so, to things that can be probably detected just with some health maintenance, both from a provider standpoint and then as friends, as sisters, as brothers, as cousins, as loved ones. Sometimes we have to jump out of our role as a provider and also talk to people from a friendly standpoint, a brother standpoint, a cousin standpoint, people that you know are just afraid to go to doctors and convince them to do things. But let's talk from the provider standpoint from a moment. A lot of times, we get these yearly labs on patients if they meet certain criteria, if they're diabetics, and we do quarterly checks of their A1C, lipid panels, things like that. I just want to make sure that we are clear as providers, especially for our new providers, that we can look and we can search till the cows come home with annual labs, and we will not find something like cancer unless something is, sometimes it's just a minute thing, like a platelet differentiation or something different with the proteins. But more than likely, you will not find a cancer by just looking at your annual labs every year with the patient. So it's very important that we risk stratify these patients. We know what their risk factors are, what patients are more prone to end up with a belly cancer or a breast cancer, and that we're being really assertive with these patients. We're sitting with them a little longer. Again, that's why the nurse practitioner was created. That's why we're so powerful, I would say. That's why we're so popular, is because we spend more time with the patient. So I would urge you to spend time with the patients, risk stratify them, know what their risk factors are, and go behind those big demons that patients are so afraid of. Because oftentimes, if you catch it very early on, then the prognosis for the patient is very, very good. Again, you're not going to really find that just in your annual labs. Make sure these people are getting colonoscopies. Make sure these patients are getting prostate exams, prostate serum monitoring, mammogram. And if your patient comes to you, that belly, I've talked about that belly over and over again, and continues to tell you that their belly hurts or their back hurts or something's not right, image those patients. Even if you have to jump through some hoops with the insurance companies, get the imaging. And if the imaging doesn't show anything, because a lot of times plain film imaging may not identify something, especially if it's hidden, get a colonoscopy on these patients. If these patients are complaining of chronic constipation, I don't care if they're 35 years old, if they have a risk factor, get a colonoscopy on these patients. Send them in the right direction. But just do this because it's so important. I can't tell you how traumatic it is, and I know it's even 4 or 5 times traumatic for the patient. But for me as a provider to be telling somebody that there's cancer all over their body from an emergency room setting, admitting the patient into the hospital. So, hey, Nikki. Hey, Courtney. So again, I just wanted to make it very clear that sometimes we're more step out of our roles as nurses, step out of our roles as providers, and even go further just to also just be the friend or the cousin or the aunt or the mom or the dad to push these people that are very afraid to get the testing that they need done. Hope that helps someone. Have a good night.